When I was younger, I wanted to take care of my ailing father. Over the years of caring for him, I realized that it gives me great satisfaction in providing care for those in need. Patients usually feel very fearful, especially before undergoing surgery. I usually spend more time talking to them to make sure they are alright. I will always be very happy to be able to give help to those who need it.
When the opportunity came for me to take on the role of social work assistant in 2012, I grabbed it and gave it my all. As a volunteer executive, my team and I are able to continuously improve and innovate new programs to help our patients. I've always loved the patients I meet, whom I would affectionately address them as Akong and Ama. I founded CAT Assisted Therapy Singapore to spread feline love to elderly and special kids. I've been fortunate to be able to put my love for animals and my desire to help others together to improve their healing process.
My father used to tell me if I had to pick a job, it should be one that is able to contribute to the society and help others. I was trained to be an ICU nurse, but when I came to Singapore and joined RENSE, my experience with geriatric patients made me realize I needed to stay and offer the best of myself in caring for them. Watching them recover and healthily getting discharged still brings me the same warm satisfaction as my first patient I remembered serving.
My work does not require me to interact with patients directly. However, I'm able to ensure that what I do makes their stay and experience here a good one. The work I do lies with hardware and facilities. We focus on what is behind the scenes, to coordinate and facilitate to ensure that everything runs smoothly across the hospital. The fulfilling part of my job is being able to contribute to the comfort of the patients recovering in the wards.
I always loved being in the service line. At NCCS, I also get to learn many things through my work and more so from the patients. Oftentimes, patients feel down and uncertain. I make it a point to take the initiative to make them feel at ease. I also make sure to give them the information they need. When they come all the way back just to look for me and I'm able to comfort them of their worries, this brings me more convictions that my efforts are able to better the experience of patients.
My mentors really influenced where I am today. I started out wanting to pursue surgery. My mentors pointed me towards the direction of ENT, and after I took it up, I thought best that I should bring all this knowledge back home to Singapore. It felt like a natural progression to me. I never looked back. With this wealth of experience I've gained, I hope to mentor the next generation of doctors and otolaryngologists to continue contributing to this field and to the care of our patients.
I grew up wanting to join healthcare and give care to people in need. My work with dementia patients showed me that we have to put in the effort and the heart to interact and learn about them to truly help them. From the courses I took and experiences I gained from my work, I believe there are new methods which can be adapted to fit the needs of our patients and better help them maintain their emotional well-being. Now, I get to help people directly, being a changing force in their lives.
Becoming an occupational therapist was something which allowed me to use what I have learned to serve and help. Constantly learning to serve the needs of every patient, learning to put myself in their shoes, to listen, to be there for them, keeps me going. To be able to work with my fellow occupational therapists and strive to learn together, maximizing each other's potential, helps all of us to grow together. What the patients sometimes really need, what we all need, is to take a moment to connect with each other and learn from one another.